I was losing so many major pieces of my life because of the pain. I'm only in my 30s. Like I should be able to do these things for a long time yet. And so I went from, I mean, essentially like a state of depression, and just being in pain all the time. And like, I'm never going to be able to have this part of my life back to like, oh my God, maybe I can actually do this.
Bertolotti syndrome is a significantly underrecognized spine condition that can lead to debilitating lower back and leg symptoms. But despite its huge impact, it is frequently misdiagnosed or worse, dismissed entirely. Many patients endure years of frustration, cycling through specialists and ineffective treatments, and that's what brings us here today. To discuss this medical mystery, I have two guests. First, Janelle Hickson. Hi, Janelle.
Hello, Jennifer.
So happy you're with us. Okay, you are a patient who refused to be silenced or sidelined. Your story is very inspirational. Your journey to a correct diagnosis and ultimately a pain-free life is a powerful reminder that there is hope, there is validation. When you get the right knowledge and support, see, your dog is supporting us on this, there is a path forward. So we're so happy you're with us. Our other guest is Dr. Colin Haines, spine surgeon and Bertolotti syndrome specialist. He is one of the few in the country who truly understands the complexity and nuances of this condition, and he has both surgical and non-surgical solutions for patients. Dr. Haines, thank you for being with us.
Yeah, nice to see you both.
All right, so I want to start with you, Dr. Haines, just so we can do a scene setter here on this condition, because doctors don't seem to know about it, so we're not going to expect, a mainstream audience to either. You are one of the few experts in the country. And what we know from your patients is that many of them have really unbelievably long and arduous journeys. I'm talking years, decades trying to figure out what's wrong with them. Why? What is it about this condition that's making that happen?
So, Bertolini syndrome, essentially, rewinding a little bit, I've got a spine model here to articulate exactly what it is. So, here's the spine. So, this is the back and this is the front. And you have these points along the side called the transverse processes. What Bertolotti syndrome is specifically is when the transverse process of the very bottom bone in the back of the lumbar spine, called the L5 level, rubs to the sacrum. Essentially, you get bone on bone arthritis where there shouldn't be it. So that painful rubbing is how we diagnose. It is what truly what Bertolini syndrome is. Now, what confuses doctors, unfortunately, is that sometimes people have imaging characteristics consistent with it, but don't have the pain associated with it. And then sometimes people have pain associated with it. That's the thing that seems to have traditionally stumped docs, is they haven't delved in deep enough to figure out the why behind who hurts and who doesn't, and which one's symptomatic and which one may not be.
But you're holding something up to me, which makes me think like you should be able to see it. So why aren't doctors seeing it? Or you're just
Yeah.
saying they see it, but they don't think it should cause pain?
That's more it, the latter, that doctors in general visually see it. It's something that if you look for it, it's there on an X-ray. It should be there on an MRI, and it's definitely there on a CT scan. But doctors don't know how to a lot of times doctors may not know how to translate what that picture means to what the person is feeling.
Okay. So we're going to get to Janelle, who's going to bring this to life for us. But before we do, one more set of questions here. Talk about the physical pain that patients report to you and also the emotional pain, because both of those are really heightened with this condition, right?
That's true. Oftentimes it starts with the physical, and when bone grinds on bone, it hurts. One of the things we think about in medicine in general, someone has bone on bone pain in the knee. If the bone hurts or grinds on itself in the knee, we have established it hurts. Same thing in the hip or even other parts in the spine. But I always thought as a physician, as I started investigating this and becoming more knowledgeable about this condition, we'd say, well, why is it that everywhere in the body bone rubbing bone hurts, but we have this artificial carve out for this one condition called Bertolotti syndrome, where we say, you know what, that's the one part in the body where if bone grinds on itself, it probably doesn't hurt. Right. So that's what really piqued my interest into figuring out more about this condition. And that what people feel is this grinding bone pain sensation, oftentimes localized right over that spot. When I examine people, typically I press on that spot, it just plain hurts. It's like having a bruise with someone applying pressure to it.
Okay. And I know you've talked about having a soft spot for these patients too, because of the emotional journey they go through till they can get to someone who believes them and can fix it. you've talked about it being emotional, like when you have that moment with patients, that's often the first time in years or decades where someone acknowledges their pain, a reason for it, and says what they can do about it. What is it like? I know you have that moment with a lot of these patients. What's it like?
Spine surgeons are more adept in general at saying, hey, you have a disc herniation or pressure on a nerve. I understand that. And patients get this immediate validation that, hey, I hurt for a reason. When it comes to Bertolotti's, as Janelle can attest to, I mean, she's from many, many states away, and that's a common condition. Sometimes it's multiple time zones overseas that people come and see us. And it's because they say, I hurt. Doctors don't acknowledge it. And this notion, what we're learning more about the emotional component of this medical gaslighting, that people hurt, and either doctors aren't knowledgeable enough to acknowledge it, or they say, you know what, yeah, Bertolotti's, but it shouldn't hurt. You'll be fine. That's an emotionally very challenging thing to say. I hurt. I'm not living my life. I'm not functional. And people sometimes, and I hate this term, but people sometimes get the implication that they're crazy, that it's in their head, and it couldn't be further from the truth.
That's a great setup, Janelle. I think I see you nodding. That's a great setup, I think, to lead into your story. So let's make this personal here. When did your pain start, and how did it impact your life?
Looking back, now that I know everything that I do know, I actually started having some problems with my lower back when I was about 12 or 13 years old, and had to start going to chiropractors regularly. Now, it was never all day, everyday pain or anything like that entire time. It was more so when I got into my 30s, probably, that it really started to impact me a lot more. I go to the gym all the time. I work out a lot, and uh, doing yoga and things like that. I've always kind of had a limited range of motion on my left side, and we knew that I had this bone, but had never been told anything about it, or that it might cause me problems at some point later on, or anything like that. So I'd really say in my 30s was when it kind of slowly started to progress. Slowly started stopping me from doing the things that I like to do. And then eventually I just hit a point. I was probably about 35, where it just went from a mild nuisance to like, I can't even stand in my kitchen long enough to cook a meal. So it
And I want to
happened
brag
once.
on you a little bit because you say, oh, I'm in the gym. You are a serious bodybuilder. You don't just do yoga, you teach yoga. Like, you are very physically active, very strong. And suddenly you couldn't teach your yoga classes. It was impacting your bodybuilding, right? You couldn't even cook. Tell me about the frustration of trying to find doctors who would listen to what the point Dr. Haines is saying, who understood, who believed. Like, how many, what kind of things did you try? How many people did you go to? What did you hear?
Yeah, I went to about 6 different doctors in the state of Iowa, all different cities. I drove all over the place. I had some x-rays and MRIs done pretty quickly. I got those done pretty much right away, when I was like, okay, I really need to find out what's going on here, because I mean, my leg was going numb. It was giving out on me. I was having all of this, like, everyone kept kind of writing it off as like sciatica, sciatic pain and things like that. And I'm like, no, I don't think that's what it is. And I did have a few doctors mention Bertolotti's, but no one really diagnosed me with it or gave me any options. They're like, oh, let's just try, a series of injections and see if that helps. I did try one. Didn't do anything. So I was like, I'm not doing any more, because I know the long-term effects of doing those consistently too. And that's just not something that I wanted to do. Doesn't work once,
So
it's
to
not going to
Dr.
work the
Haynes's
second.
point, no. And to Dr. Haynes' point then, right. So they said, oh, you have it, but it shouldn't be causing this. Dr. Haynes, I want
Yes.
to have you jump in. She mentioned sciatica. I know this is something we hear from Bertolotti's patients a lot. They're either told, oh, it's sciatica, it's disc-related pain. Oh, you're just born this way. How
I
does
have disc
it
issues
differ?
too.
What did you, sorry, say it again,
I
Janelle?
have some disc issues also. So they were looking
Mhm.
at the disc issues and thinking that was my problem, and not the Bertolotti joint.
That's common, right, Dr. Haynes? Do you hear this
Mhm.
kind of confusion a lot over those things? And how do they all differ? What should patients and doctors be understanding?
It's very common. Speaking directly about Janelle's back, we did a disc test to analyze the discs. As someone who treats Bertolotti's a lot, I also treat a lot of other spinal conditions. And if I were in Vegas and betting, I would have bet that it was the Bertolotti's and the discs. Until we did these subsequent, more detailed tests, I wouldn't have known, even as what I consider a Bertolotti's expert. So even those who are very in the know in Bertolotti's can be wrong if we don't do the proper tests. It's common, things are common. Disc conditions that cause pain, that cause symptoms, percentage wise, are more common in people than Bertolotti's syndrome. I think that's one of the things that unfortunately has doctors not recognizing it. Uncommon things happen. And one of the things that you mentioned, this has become a big passion of mine, because so many really good people like Janelle have a lot of pain, a lot of physical and emotional turmoil, and can't get the answers. And it's been very, very just personally and professionally gratifying being able to help people like Janelle out, doing the proper analyses. And just because uncommon things don't exist as much as disc issues doesn't mean that Bertolli's is not a true condition. That's why patients like Janelle oftentimes know more about Bertolli's syndrome than their own doctors do.
For sure. And that's why, Janelle, we're so grateful that you're sharing your story. How did you and Dr. Haines, how did you get to him? You're in Iowa. You've done your 6 doctors in Iowa. He's in Virginia. How did you make that decision?
I kept hearing the same things over and over. Like, it's the disc issues. It's this, like, let's just do injections. You don't need surgery. Check back in 6 months, whatever. And I was just getting so frustrated with all of these doctors not believing that this was causing my issue and just basically wanting to push things off, slap a Band-Aid on it. And I just kept searching, like Google searching, looking on Facebook. I found a group on Facebook, which helped a bit. There's a few thousand people in there that have it. And Dr. Haines was mentioned in there a few times. Where I actually came up with him, though, was on Instagram. I did a search on Instagram, like hashtag Bertolotti syndrome or whatever, and one of his videos came up, and I was like, is this even real? So then I had to do some research on VSI and everything too.
Make sure he's not AI. It's a real thing. Yeah.
Yeah. So then I ended up calling the office and kind of went from there. I did the, virtual consultation, and, he asked for some extra testing and things like that. I CT scan, whatever. I got that done, sent it on, and then headed out there not long after. I mean, once I found him and I did the consultation with him and everything, his knowledge of it, he made me feel so comfortable and confident that, like, he could help me one way or the other. I was like, I don't really care what I have to do to get there. I'm going to get there. So I'm just being incredibly persistent and, like, all day, every day searching.
Dr. Haines, you're worth traveling many states for. Janelle, emotionally, what did it feel like when you finally found someone who was like, yes, I know what this is. And not only that, there's multiple things in our toolbox to treat it. We'll figure out which one's right for you. But emotionally, what did that feel like after trying for years?
I honestly don't even know if I can express how much of an impact that had on me, because just going so long with no one actually listening to me, or wanting to take the time. Like, I was just so happy and so thankful, that I found him and was able to work this out. And, just the thought of, I was losing so many major pieces of my life because of the pain. That hope that, like, I might actually be able to do this again, And I mean, I'm only in my 30s. Like, I should be able to do these things for a long time yet. And so I went from, essentially like a state of depression, and just being in pain all the time. Like, I'm never going to be able to have this part of my life back, to, like, oh my God, maybe I can actually do this. And it was very cool. So.
Awesome. Dr. Haines, what is in your toolbox? Once Janelle makes it to you or another patient makes it to you, what are the options? You talked about the scans and the things you have to do to sort of figure it out. What are the treatment options? And how did you figure out what to do for Janelle?
Yeah, it somewhat depends what the individual person has. I very much have this individualized, customized approach. And there are times that people can have the same images, but based on how they're feeling emotionally and physically and their goals in life, our treatments may differ. My thought process with Janelle was that we were going to be talking about fusing the Bertolotti's joint and doing disc replacements at the other levels of the disc deterioration. And the more we analyzed it, the more information we got, and the more we talked, I realized those other discs did not hurt and that she didn't need a fusion. She needed what's called a resection. So in general, there are a few major principles when it comes to Bertolotti's syndrome. One of them is that oftentimes non-operative surgery or non-operative treatments rather can be extremely effective. There are cortisone injections, there's physical therapy, something called regenerative medicine or stem cells. These are using someone's own healing tissues to do the healing. There's this group of non-operative treatments that can be very effective, but oftentimes, just like Janelle, those boxes have been checked already.
And
So
the longer the pain goes on, sometimes the worse the degeneration, and you have fewer options the longer it goes on, right? Is that right?
yeah, that's true. The more arthritis there is, sometimes those non-operative treatments may not be as effective. So when we start getting to that point of saying, okay, enough's enough, those treatments didn't work, what do we do? The two big categories, there's a resection or just creating a gap, creating space so that bone's not rubbing on itself. And then there's a fusion or sticking the bones together. So in general, the principle I like to illustrate is if there's a gap, the bone doesn't rub on itself. If there's a complete fusion, the bone moves as one big unit, so there's also no rubbing. But when there's just the wrong amount of space, which was the case for Janelle, that bone really grinds on itself. So ultimately, in general, in my opinion, and what the data shows and what our experience shows, is that you can have a fusion or a resection and you do really well. What I think more so about is, well, what's the longevity? Not just how do we fix Janelle now, how do we keep her fixed 6, 7 years from now, and then 6, 7 decades from now.
Because she's only in her 30s, as we said, right? Let's get to the good part. What life is like now. So that surgery was in the fall of 2024. You are back in the gym, and by that I mean you are bodybuilding again. You just hit a new personal best. Tell us what you're able to do, and do you have any pain at all? Is it totally gone? Is it a little bit? What's happening?
No pain whatsoever ever since surgery day one, like none. I'm back to teaching yoga.
Wait, can I just stop for wait, hold on. That's crazy. That seems crazy to me. Does that seem crazy to either one of you? Like years of pain and suddenly boom, it's just gone?
I still have days where I can't believe it. Like, I mean, I'm obviously, the day of I was still on, I had some pain medication and stuff for a few days, but I didn't even take pain medication for more than 2 or 3 days. And the post-surgery, and after that, it was just ibuprofen for maybe a couple more days and then nothing. And I still sometimes, I've been standing and it doesn't hurt, so it's been a couple months and I'm still like, I can stand at my desk at work all day long now if I want to, and it doesn't hurt. But I feel like I'm gaining a little bit more of a range of motion back again in my left side. I can tell when I do yoga a lot more, which is awesome because I'm like, I could never get down this low before. I couldn't do that before. In my squats and things like that, when I'm lifting, I can get a lot more depth in my squats now too than I ever used to be able to do. I always had like a physical barrier stopping me from going to a certain point, and it's not there anymore. But yeah, to your question on my personal best. So before my surgery, before my pain even got really bad, before my surgery, I'd say if I was doing a squat in the gym, the heaviest I probably ever went was 185. And just a couple days ago, twice now I've done it. I hit 225 for the first time I did it, I got 5 reps. The second time I did it, I got 6. So
is that okay, Dr. Haines? That's a lot of weight.
Well, before we get to that, one thing I do want to say that in terms of your recovery, I mentioned fusion and resection. Again, both can fix it, but looking at the individualization of it all and really looking at Janelle specifically, a resection is a quicker recovery. It tends to hurt less as well. So while fusion works really well, it takes longer and the risks can be a little bit higher with that. So what I see in my experience is that with resections that people get the same long-term relief it doesn't risk that next level breaking down the disc above, but also you tend to feel better quicker. In terms of your squatting, that's incredibly impressive. I actually don't worry about the Bertolotti's level with squatting like that. It's just something I counsel all my patients on. Using the bar squats, that puts a lot of force on the discs above. So you got to be careful with that. Using perfect form is critical. The nice thing is with squats, pistol squats, just using body resistance, or even doing, once you're good at those pistol squats, a one-legged squat essentially.
Mhm.
Once you're good at that, if you put any weight in the arm while you're doing it, that's another way to really work the core, the glutes, the legs really, really well. So I'm incredibly impressed. You can keep doing it. There are some alternatives long term I may want you to do, but we can talk about that in our next
I'm sure
I
her,
very slowly worked my way up there, I
Yeah.
promise.
I know you did. I trust you.
and I'm
But
sure
you're
her.
also, Janelle, you're not the average person. You've been doing this for a long time. So if someone off the street goes and tries to squat that, they're much higher risk of injuring
I was
themselves.
just gonna say she's going for her pro card in the
Yeah.
wellness division, so like we're talking about an elite
Different
level
ball game.
here. I'm gonna mention one other. Let's brag on you because your deadlift too. That's up like 65 pounds from pre-surgery, right?
I did 265. I only got
Unbelievable.
3, but so the first time I did it, I got 2, and then a week later, I did it again and I got 3. So yeah, I'm very much, once I get to a certain point with the weight, I'm like, okay, that was kind of tough. I did 3. We're just
Yeah.
gonna stick here until I can do more, and then it feel. So I'm don't worry, I'm not gonna jump up much higher than that very quickly. I'll make
I
sure I
feel
can
like there's
handle it really well first.
All joking aside, deadlifts, I feel a bit better about than using ideal form squatting. Deadlifting is part of life. So the
Yep.
only one I really caution people in general about is that bar squat. That's a lot of force to the back, but seriously, super
I
proud.
know
We're
we're
so
proud of
happy
you.
how well you're doing. It's amazing. I mean, this is
Thank you.
life changing, awesome, inspirational stuff you're doing.
I mean, look, this is the whole point, right? Dr. Haines, to help people get back to the thing that they want to do. Janelle, what does it mean to you? Like, did you know you could get back to this and be better? And what does it mean? You said sometimes you have moments when you're standing still, like, holy cow, I can't. Like, what does it all mean as you're back to doing this stuff?
Everything. I knew I had definitely I had a lot of faith that I would be better, or I wouldn't have any pain, and I'd at least be able to maintain the level of fitness that I was at the time. Um, but to actually be able to go beyond that and better than what I've ever been before, I wasn't exactly expecting that. So it feels awesome. So just absolutely amazing.
So great. All right. I want to end, guys, on a lightning round where I ask a question and I want the doctor patient perspective. Let's let the patient go first. So for each question I ask, I've just got a couple here. I want, like, real quick, Janelle, like one sentence from you and then Dr. Haines, one from you. Okay. What do you think is a common sign or a red flag for someone if they have Bertolotti's, that if people are watching this and like, could that be me? Is there like one thing you would tell them? Janelle.
I feel like one thing I would tell them as far as like a symptom, like maybe they should go get it checked out, or one thing
You
just
can
like
take it whichever way you want. Yeah, I don't
okay.
know, from your
Um
experience.
from my experience, and even like that, I mentioned the Facebook group that I was in as well, I see a lot of the same symptoms in people. I mean, it's different but the same, where it's like hip pain and leg pain and things like that. I try to just encourage people, like, don't rule this out, have get an x-ray, get another opinion, that kind of thing. I am just, it's always at the back of my mind now. And I will say, actually, my daughter is starting to have a lot of similar symptoms, and she's
Oh
about the
no,
same age I know. So I'm
I
like,
didn't know that.
I kind of want to take her somewhere and get an x-ray and see what it looks like.
Yeah.
I will happily
So
review it. I hope it
don't
looks
sleep
perfect.
on
But
it. Just go
no.
do it.
Just go do it. All right, Dr. Haines, what about you? Is there like one red flag or symptom that you would highlight for people? Or is it just something you should ask if you
Yeah, well, Bertolotti's, because so many doctors are not familiar with it, even the spine specialists. My general litmus test for getting something checked out is, if something doesn't feel right, it may not be right. Investigate it. One of my recommendations would be is a lot of spine surgeons, maybe they see Bertolotti's, but they don't actually tell the patient because they're sprinting through a bunch of patients through the day, which is, in my opinion, not the type of care that I want to provide ever. But review your radiologist report. A lot of times the radiologist mentions it because it's part of what they do. They just look through everything. But the doctor, while they may recognize it, they may not believe it. So they just pass it on.
And sometimes
That's
it
the
may say
radiologist report.
Bertolotti's, but sometimes it might say pseudoarticulation, right? That's what I've heard from, that's a long word, but
Yeah.
it might mention that, right?
Yes. So pseudoarticulation means essentially a false joint where there shouldn't be one there normally, and that's what that term means. It's a synonym. So yeah, a pseudoarticulation or Bertolotti's joint or Bertolotti's syndrome, any of those words that should raise the red flag.
Okay, next question quickly. One piece of advice for someone who feels stuck, like you, Janelle. They've gone to 6 doctors. They just aren't getting anywhere. What's the tip? I don't know. Maybe it's that Facebook group you mentioned, but I don't know. What do you think what helps you get unstuck?
It's just don't give up. Like, it's your life. You need to be able to live it. Do not just sit there and let other doctors or anyone else tell you that, this is just all in your head or anything else. Like, you need to be your own advocate. Unfortunately, get mean if you need to, you know what I mean? Ask all the questions, and just, I think I got to a point where I just got angry. And that was really what it was. Like, when I get angry, I'm like, nope, this is what I want. This is what I'm doing. And I just go and I do it. So if you need to get angry and just go find your answer. And I'm constantly referring people to BSI.
Dr. Haines, let me slightly shift that question for you as we wrap up. How can patients advocate? Okay, getting angry is one. Asking questions is another.
Happy Janelle.
I know. That's good.
Tread lightly. But I think it's, Janelle, I think you hit nail on the head. As much as I hate that patients have to do that, be your own advocate. Keep fighting. Keep investigating. As I mentioned earlier, I think my most knowledgeable patients about the spine in general have Bertolotti's, and it's because it's taken them years of their own research to finally come to me or another Bertolotti's expert, someone really knowledgeable about it. Keep looking, and the Bertolotti's Facebook page. I mean, all these message boards with new technology. It's amazing how much we can learn that, frankly, people wearing white coats miss.
I agree. It's really inspiring how much patients are helping other patients figure this out. And so, Janelle, you sharing your story today is a huge part of that. Thank you so much for doing that. Dr. Haines, thanks for joining us. If you have that pain, don't give up. Janelle, appreciate it.
Yes,
look, the dog wraps us up. I agree. Thank you both.
All right. Thanks again.